Chapter 18 The Pharynx, Soft Palate, and Larynx. Question 1 The respiratory tract is crossed by the isthmus of the thyroid gland at the level of the A. Thyroid cartilage, B. Cricothyroid membrane, C. Cricoid cartilage, D. Tracheal rings. Correct answer is D. Tracheal rings. The thyroid gland is low in the neck and the upper poles of the lobes of the gland only extend as far as the thyroid cartilage. The isthmus crosses the trachea, usually at the level of the second to fourth rings. Question 2. The muscles of the soft palate are innervated by branches of the A. Trigeminal and glossopharyngeal nerves, B. Facial and glossopharyngeal nerves, C. Trigeminal and vagus nerves, D. Facial and vagus nerves. Correct answer is C. Trigeminal and vagus nerves. The muscles of the soft palate are derived from the fourth pharyngeal arch with the exception of tensor veli palatini, which is a first arch derivative. It follows that the muscles are innervated by the vagus nerve, through the pharyngeal plexus, and a specific branch of the mandibular trigeminal nerve to tensor veli palatini. Question 3. The mucosa of the upper larynx is innervated by the A. Internal laryngeal nerve, which is the afferent limb of the cough reflex, B. External laryngeal nerve, which is the afferent limb of the gag reflex, C. Internal laryngeal nerve, which is the afferent limb of the gag reflex, D. External laryngeal nerve, which is the afferent limb of the cough reflex. Correct answer is A. Internal laryngeal nerve, which is the afferent limb of the cough reflex. The internal branch of the superior laryngeal nerve is sensory to the mucosa of the larynx, whereas its external branch is motor to the cricothyroid muscle. The cough reflex occurs due to irritation of the laryngeal mucosa, whereas the gag reflex occurs in response to foreign bodies in the oropharynx. Question 4. Laryngeal edema is usually confined to the larynx above the vocal folds because A. There are numerous mucus glands in the vestibular folds, B. The mucosa covering the vocal folds is tightly attached to underlying tissues, C. Fluid will drain rapidly into the thorax below the vocal folds, D. The mucosa above the vocal folds is more vascular than that below the vocal folds. Correct answer is B. The mucosa covering the vocal folds is tightly attached to underlying tissues. Edema usually occurs between the mucosal layer and underlying connective tissue and gravitates down the larynx. The stratified squamous epithelium forming the superficial surface of the mucosa covering the vocal folds is tightly bound down to the connective tissue covering the vocalis muscle and prevents flow of fluid below that point. There are mucus glands in the vestibular folds and there is no apparent difference in vascular density in different parts of the larynx. Question 5. Tonsillar tissue is commonly found A. On the posterior wall of the oropharynx, B. Under the mucosa of the ventral surface of the tongue, C. Between the palatoglossal and palatopharyngeal folds, D. At all three sites. Correct answer is C. Between the palatoglossal and palatopharyngeal folds. Tonsillar tissue forms the pharyngeal tonsil on the posterior wall of the nasopharynx, the lingual tonsil on the posterior part of the dorsal surface of the tongue. The palatine tonsils are located between the palatoglossal and palatopharyngeal folds. Question 6. The auditory tube A. Connects the inner ear and nasopharynx, B. Is derived from the second pharyngeal pouch, C. Is opened by the action of levator veli palatini, D. Is closed by the action of tensor veli palatini. Correct answer is C. Is opened by the action of levator veli palatini. The auditory tube connects the middle ear and nasopharynx. It is a derivative of the first pharyngeal pouch embryologically. Both tensor and levator veli palatine muscles attach to the auditory tube, but their action is to open the tube to equalize pressure across the tympanic membrane and drain fluid from the middle ear. Question 7. Laryngoscopic examination of the vocal folds after suspected recurrent laryngeal nerve damage usually shows that the vocal fold on the injured side is tensed and in an intermediate position between adduction and abduction. This is because a. Cricothyroid muscle is still functional but the interarytenoid muscles are fully active. B. Cricothyroid muscle is still functional but the interarytenoids are weak. C. Cricothyroid muscle is paralyzed but the interarytenoids are fully active. D. Cricothyroid muscle is paralyzed but the interarytenoids are weak. Correct answer is B. Cricothyroid muscle is still functional but the interarytenoids are weak. The cricothyroid muscle is supplied by the external branch of the superior laryngeal nerve, therefore is not affected by recurrent laryngeal nerve damage. It tenses the vocal fold and its action will be unopposed because vocalis is paralyzed. The interarytenoids are unusual in that they cross the midline and receive a bilateral nerve supply from both recurrent laryngeal nerves. If one nerve is injured, the muscle will still receive some nerve supply but its action is weaker, resulting in the intermediate position. Again, its action is unopposed because the posterior cricothyroid muscles are paralyzed. Question 8. When an emergency opening into the airway is required, the cricothyroid membrane should be pierced immediately. A. Superior to the thyroid cartilage. B. Inferior to the thyroid cartilage. C. Inferior to the cricoid cartilage. D. Superior to the thyroid isthmus. Correct answer is B. Inferior to the thyroid cartilage. The cricothyroid membrane is in the anterior midline of the neck between the inferior border of the thyroid cartilage and the cricoid cartilage. It is palpable between the two cartilages, especially if the neck is extended.